This is Lesson 5, Part 9, Full Circle of Life and Family Care. In the veterinary profession, we offer full circle of life veterinary care. We see our patients from the time they are puppies and kittens all the way through their geriatric years, and then we walk them through end-of-life care options. However, our care should not end when a patient dies. We continue to support our pet owners through that year of firsts after a patient dies. We support them through adopting a new pet if they decide to welcome a new pet in their household, and then that circle begins again where we're watching that pet grow and age, and we develop really good relationships with our pet owners when we're offering full circle care. We care for the whole family. If there is a husband and a wife and children, grandparents, whoever living in the household, we support all of the people who have a relationship with the animal. Society tends to forget when we have a loss, so the loss is imperative. Human losses have a really good example of this. So if you lose a human in your family, you go through the wake and the cremation or the funeral process, the burial process, and you have all your family surrounding you and supporting you during that time. But then as the days go on after the funeral and burial or cremation are over, everybody goes back to work, everybody's life kind of gets back to normal, but the people who were most greatly impacted by the loss, your life is in an uproar. So it's important for us to remember that society kind of really dismisses and forgets the loss of a pet, but it's our job as veterinary professionals to kind of walk with pet owners through that, to let them know that we haven't forgotten that loss occurred. The other thing is that we have the ability, through compassion, empathy, and sympathy, we have the ability to make a loss experience be not so horrible. I'm always amazed by the number of thank you cards that we get from pet owners for euthanizing their animal. We do all sorts of really cool things in the veterinary profession. We do awesome spays, we do awesome castrations, we do really good surgical procedures to preserve life, to maintain health. We do really good treatment that we can provide pet owners to make them safe and comfortable, but we very rarely get a thank you card for saving an animal or for maintaining health on an animal. But we do get a lot of thank you cards for walking pet owners through a pet loss procedure, or for caring for pet owners after an animal has died. That's because we're really good at being compassionate just overall in this field. This is a very compassionate field. So we have the ability to make our care better, and I encourage you as a veterinary professional to make it a point to be good at caring for people. Veterinary professionals are the group of people who will continue to support our pet owners through pet loss. When society tells them, it was just a cat, go back to work, or get over it, get another animal. When society is telling them those things, we are the community that our pet owners are going to rely on, so that they don't feel like they're going crazy, for lack of a better word. We want our pet owners to feel supported, and we want to make a loss experience be as positive as possible. We have the ability to positively impact grief and loss, and we should make it a point to be doing so. I really like when children are involved in the grief and loss process. They ask a lot of good questions. They offer a lot of insight. They help us to gain perspective on loss and the emotions that go with loss. Often the first experience with loss that somebody has is due to the loss of a pet. How that loss is handled kind of dictates how the rest of the losses we experience in life will be handled. So for example, a child might lose a dog at an early age, and how that dog's loss is going to be handled will impact how that child manages the loss of a job, the loss of a relationship, the loss of a home, the loss of a flash drive. Anything that a person can experience loss with, our ability to manage or deal with that loss is heavily weighted on how we experienced our first loss. Adults should be models for emotion. We should be modeling to children appropriate ways to express our emotions. Suppressing our tears, not crying in public, those are telling kids that it's not okay to express those emotions. So we need to make sure that our children see us crying, not that we are sobbing and blubbering on the floor and totally incapacitated with grief, but that we are able to cry and then address the positive memories of our emotions and kind of move through those emotions of grief in a healthy way. Veterinary professionals are great at assisting in this with pet owners. So one of the things that I find myself frustrated by is that a lot of times pet owners don't want their kids in the exam room during a euthanasia procedure, or they don't want their kids to come in afterwards and say goodbye simply because they are uncomfortable with it. If that's what's happening, then it's our job as veterinary professionals to let the pet owner know that we are there to support them and that we are there to make it a positive experience for both the adult and the children in the room. How a child deals with loss or grief is hugely impacted by the age group that child belongs to. For example, 1 to 2-year-olds tend to experience loss and respond to loss by watching how others are dealing with loss. So if mommy is crying, it's likely that a 2-year-old will cry too, even though the 2-year-old might not understand what mommy is crying for. A 2 to 6-year-old, they do not realize that death is permanent. Losing a pet is a really hard way to learn what forever means. This group of kids may display their emotions through play. All of these groups, it is important that we inform teachers, therapists, social workers, counselors, parents of people, other people who might be watching our children or responsible for our children, a nanny, a daycare center. All of these people should be informed that a loss has happened in the house, because kids might express their emotions through play. They might be playing with, let's say, some dolls or some blocks, and they might build a gravesite for their pet, or the pet of their doll might die, or one of the dolls they might even say died. So we need to make sure that everybody who has contact with the children are aware that the loss has happened. 6 to 12-year-olds do understand that death is final, and within their social group, they will usually have sympathy or empathy being displayed by other children. Oh man, I'm really sorry your dog died. They'll get those types of support from their social peers. So again, it's important that we let everybody know that a loss has occurred. Teenagers are teenagers. They kind of balance, teeter-totter back and forth between needing support and wanting support, and they tend to have difficulty in asking for it. So it's good that we, as parents and as pet loss professionals, let them know that the support is available, and that we can kind of offer it to them and be models of our emotions for them. As adults, we tend to not handle our grief emotion as well as a child would. Children do what's called self-dosing. They might, when we're standing in an exam room talking about something that's a heavy topic, or maybe about their pet who death is imminent, a child who might be in the room, they might appear to be attentively listening, or they might be fidgeting and it doesn't seem like they're paying attention. And when it comes time to asking questions, they might ask a really thoughtful, thought-provoking question, and you'll give them an answer, but then they might leave the room and go play with stuff in the waiting room. And as an adult, it looks to me like, this kid, I just asked a question and now he's walking away. But then if you let them kind of play and manage themselves in your waiting area, what you'll find is that they typically come back and they ask another thoughtful question, and you answer it. We try to be as blunt and as honest as possible, but we try to avoid giving lots of detail when we're talking to children, unless they're asking for details. So you'll answer the question, and then they'll go back out into the waiting room and play again. But what they're doing is they're actually sitting out in the waiting room, and they are addressing their emotions, they're dealing with their emotions, they're considering the questions that they might have, and then they return to the stressful situation to work through that emotion. So what they're doing is self-dosing. As adults, we tend to wallow. So it's a lot more healthy. That's a lot healthier to self-dose grief than it is to just kind of let it overcome us. So if we kind of make a conscious effort to address our grief needs, allow grief to occur, allow loss emotions to occur, but then take a step back and allow us to find balance in our life too, is a healthy way that we can manage our emotions. I like when children are able to participate in the loss experience. It's ultimately the parent's decision, and this decision is based on age-appropriate participation and the mentality of the child. If the child is not mature enough to handle being in the exam room when we're talking about grief and loss or when we're performing a euthanasia, then certainly it's the parent's responsibility to have their child step back. But again, we don't want the adult's discomfort to be what disallows children from participating. We want to make sure that children are able to say goodbye, so if parents are deciding that they should not be in the room, we need to educate our parents that they should allow their children to say goodbye either before they come to the animal hospital, or we can allow our children to come in the room and participate in a portion of the preparations for loss, but then have them step out during the actual euthanasia. They can say their goodbye beforehand, or they can come back in after the euthanasia is done and the pet has been pronounced as deceased. We can have kids come back in the room and they can pet their animal, they can talk to their animal, we can give them clippings of fur, paw prints. We want them to participate because we want them to see that loss is a part of life, and we want to make sure that we're good models for how loss can be managed and how loss can be balanced within life, because as much as we don't want it to happen, loss of all kind does indeed occur. When we have children who are participating in a loss experience or participating in a euthanasia or who have lost a pet, one of the things that I like to recommend to my pet owners is setting up a memory table. There's no expense to this, and it's a minimal time effort, and it's something they can do in the privacy of their own home. So it's especially really nice for people who cannot afford some of the memorialization options that we will talk about in a later lesson. A memory table, we can tell pet owners that what they can do is they can just set up a table somewhere in their house, whether it's a card table, a coffee table, an end table, whatever surface they decide to use. But what they can do is they can put pictures of their pet, they can put any sort of a favorite toy from the pet, the food bowls from the pet, leashes, collars, bedding from the pet, if a pet wore a sweater, all of these things can be included on the memory table. And what this memory table does is it allows everybody to kind of grieve in their own way. When we had a memory table set up in our house for our cat, we had my son was on the verge of entering those teenage years, so he was kind of too cool to cry in public, but still child enough that he was wanting and needing to express grief. The memory table was great for him because he could go visit the memory table by himself, or he could visit the memory table with us, and we could go through pictures of our cat. We also had a journal on the table where we were writing some of our fun memories of our cat. And what I found is that even though my son did not want to participate in this memory table initially, we would go to bed at night and wake up in the morning, and then there would be things that would magically appear overnight, like one of the cat's toy mice appeared one night, and the next night there was a funny story written about the cat in the journal that my almost teenager, was able to express these things without feeling like he needed to hide his emotion, or without feeling like somebody was judging him for crying. Everybody grieves in their own way, and a memory table is a really nice way to let that happen. The other nice thing about memory tables is that from a tangibility aspect, we are visual creatures. We are attached to what we see. The memory table is kind of a nice transition. Your pet who was once in your house is now no longer there. We no longer see the physical aspects of our animal. So the memory table kind of allows us to transition by looking at pictures, by looking at artifacts that remind us of the animal, although the animal is not there. So it allows us to kind of live through those memories, which allows everybody to grieve in a way that they need to grieve to work through a loss emotion.